I want to talk about a concept that it's not, well, I guess it's a concept I kind of came up with and see if you agree. So we all recognize that Rhode Island, along with most of the other New England states, have a high cost of living, right? Compared to other parts of the country, right?
Yes.
Nobody disagrees with that.
Yes.
Um, I call that local inflation. You talk about spending. Inflation is caused when you have excess money supply caused by too much spending, too much money in the system in consumers' hands, and combined with limited output supply of goods and services that could be caused by government regulations. That's the general definition of inflation. It's measured by prices, but that's what causes it. So when you look at, to me, there's three areas of spending or money. I should say money coming into the state. It's what the state spends after it collects taxes. It's what they get from the federal government in grants and other federal dollars. And it's what they get on bonds, right? When they get bonds from, bondholders to build new projects. And we do a lot of both. So when we look at high cost of living, isn't that really just high local slash state inflation caused by too much government spending, too much whoring of money? Just give me money wherever I can get it from, and a regulatory regime that restricts the outputs of goods and services. So the high cost of living to me is not sent down upon us from God above to the New England region. It's caused by state policy. Your thoughts?
Yeah. So I would say I think the federal government spending during the pandemic definitely contributed to inflation.
Oh,
But
there's
wages,
clearly national inflation too, clearly.
and wages grew as well. And so our wages have had a strong amount of growth. I think our higher cost of living compared to other states is, economists attribute it to high housing costs, high energy costs. We have one of the highest in the country, and relatively high taxes. So,
All
and
of
we
which
have,
is state policy, right?
and healthcare costs. So we have those type of things. Now even at that, we're not among the highest in the country. We're, I don't know, 14th, 15th. So there's more expensive places. We're a city state, so it's a little different, right? So some
Right,
places that have a metro, that's more expensive
right.
than the rural areas. But that's what I would, I really can't comment on the economics.
But
Obviously,
all of those high costs you just mentioned, Mike, are due to policy, public policy.